And also, you think I've had them on it. There's been a few verticals I've not. Dealing with different levels of return. Like 2 levels down on that. And then, so that first one, then I had to move it up some. So this one, I'm like, I remember the last group. And then, I guess another thing that counts for too, a lot of people. Like, sliders, roads, stuff. Yeah. It may seem a little high in one area, but that another spot, we gotta account for that. But yeah, then I went up. I don't know. One of them.
Start the Health and Human Services Committee meeting for Wednesday, February 9, 2022. First of all, we'll start with public comment. Start the Health and Human Services Committee meeting for Wednesday, February 9.
Al, stop repeating yourself. You just said that, Al.
Yeah, yes. Are we ready?
Yeah.
Okay. There's no one in the room for public comment. Is there anybody online? Nope. Okay, we'll move on. Consent items. Can I have a motion to approve the agenda?
So moved.
So moved.
I mean,
All in favor, say aye.
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 Same sign for no. Okay. Can I have a motion to approve the proposed minutes for January 12, 2022?
Support.
Okay, I have a motion and a support. All in favor, say aye.
Aye.
Thank you. Same sign for no? No. Okay. Action items, none. Discussion items. Sexual health in the pandemic era. Debbie Price, nurse practitioner, supervisor for Ottawa County Department of Public Health. Debbie, you got the floor.
All right, that would be me now. Where is my last time I was with you, that was the first time I had ever shared my screen and it worked. So now let me see if I can get that to work again. What are you seeing now?
Sexual health in the pandemic era.
Perfect. You see my slides. All right. Is it, when I advance a slide or two, we'll make sure it's big enough for you to see. Yeah, so as you said, my name is Debbie Price. I'm the supervisor of the sexual health team. I've had the privilege of presenting to you a couple times before, and the topic this time is the impact of the public health emergency and the precautions that we took during that time on STD epidemiology and access to care. So the data nerds will be happy for that epidemiology piece because it means that I have something to share with you. So let's see here. My slides will advance. So I hope now you're seeing a slide on chlamydia and gonorrhea.
Yep.
Okay, perfect. And there are two graphs at the bottom of that slide, and those show the data for chlamydia and gonorrhea cases in Ottawa County during a long period of time. I can't even read the years, but you'll see a green dotted arrow and a red dotted arrow. And what those arrows are showing is that we had a period of some time where the number of cases was going down for both chlamydia and gonorrhea. And since somewhere around March of 2020, they started to go up. That's the red arrow. So numbers,
Debbie, did
yes.
you say March of 2020 is when it started going up?
So yeah, during the pandemic time.
That's when it started too. So,
yeah.
That's interesting.
Yeah.
I would think it would go down because people would be less close to each other, but okay,
Well,
never mind. Sorry to interrupt you, but I'm just.
We could have hoped, and I'm happy to take questions as we go along. Thank you for clarifying. I was being cagey using the date, but yes, that's what I was trying to show, that during the pandemic, the numbers have started to increase again. And the males and females aged 20 to 29 have shown the largest increases in 2020. And over the last 4 quarters, females have outnumbered male cases for gonorrhea, which is a trend reversal. It used to be males outnumbering females for that particular infection. The next slide shows the numbers for syphilis. The graph on the top is national, but it is a concerning increase in syphilis in females. And you can see the numbers for Ottawa County there. We have very small numbers. We only had 14 cases and 12 cases pre-pandemic, but that's gone up to 24 and 28, so it's doubled. Even though it's small numbers, it is a concerning trend. And of course, if we have syphilis in the female population, the risk is that we'll start seeing congenital syphilis in newborns. And we have not seen that in Ottawa County, but some other locations in the nation have seen it. I have seen congenital syphilis when I worked internationally, and it's a really sad thing. So we want to make sure that we avoid that.
Debbie?
Yes.
And I know this is probably a stupid question, but what's the difference between syphilis and gonorrhea? I mean, you've got a separate screen for syphilis. So I'm taking it as it is more difficult to control or kill or stop?
So that's an excellent question. Actually, both of them are quite easily detected and easily treated. They're just different infections have different treatment. But yeah, if we, particularly when we're talking about congenital syphilis, if women are accessing prenatal care, then it should be detected and treated, and we won't see it. We won't see the effects on the newborns.
Thank you.
You're welcome. So what's the public health importance of this disturbing trend? Well, if sexually transmitted diseases are left untreated, they can have long-term health consequences. And those include infertility, cancer, birth defects, and even death. So it's really important that we address this. So why are we seeing this trend? What was the effect of the pandemic on STD testing and treatment? Well, the first thing is that in many locations, STD program staff were deployed to the COVID-19 response. So of course, while they're working on COVID-19, they were not able to continue providing STD care. We were fortunate here in Ottawa County that we were able to keep most of our STD program staff time on STD. We did have to deploy them a little bit to COVID-19, not as much as some other counties. Our appointment profiles had to be reduced. So we couldn't have a lot of clients in the waiting room at a time. And we also had to have time for cleaning rooms between encounters. So we had to slow down the appointments. We weren't able to do STD testing at our outreach sites for several months. And that's an important location where we pick up infection and are able to treat it. Routine screening was less available, not only here, but everywhere. PCP offices, private physician offices were not doing routine screening. And we went through a period of several months where if someone called and said, you know, I'd like to be screened, but they didn't have any particular risk factors, they weren't a contact to a case or weren't testing positive, you know, we were putting them off and saying, well, call again next month and call again next month and then call again 3 months from now. So with less screening, of course, you are less likely to pick up the infections. Test kits were diverted to the pandemic response. It's a sad thing that the same items that we use for testing of chlamydia and gonorrhea were used for testing COVID-19. So test supplies became short, and we had to slow down our testing for a time until that production caught back up. There were also changes in sexual behavior, including more risk-taking. So that addresses one of the questions earlier. You know, if people weren't getting together, shouldn't we have seen less infection? But in fact, they were getting together. And clients were reluctant to present for testing or really for any routine care. And again, that's not only at the Department of Public Health here, but everywhere. We saw people, you know, not going for their routine care, for their well woman visits, for, you know, just anything at their private physician offices. So what did we do about it and what are we doing about it? We did continue providing STD care continuously throughout the entire public health emergency, even though we had to slow down a bit at times. We prioritized clients who were a known contact or having symptoms because they were the ones more likely to be having an infection and more likely to be spreading it. There were new treatment guidelines that came out from the CDC and MDHHS that allowed us, for example, to expand our partner treatment. So it used to be if we were treating a patient, you know, we told them your partner has to come in. Well, if the partner didn't come in, the patient would get it back and the partner would keep spreading it. We were able to do more partner treatment during this time. You know, say to the patient, here are some tablets for your partner, please take them home and have your partner be treated as well. So that helped a lot. We started doing some STD Express service. So, you know, when we had to slow down our appointments, we were able to do some of our assessment and counseling by phone. So we call the patient, do that part by phone, and then have them come in for a shorter time and be able to see more patients that way. We also started doing what we call a brown bag for specimen collection. So just put your little specimen container in a like a paper lunch sack, have it at the desk. Patient would come by, pick it up, go place their specimen in the cup and bring it back. So we were able to do more routine testing that way. Even though we couldn't have people coming in for those routine testing appointments, we were able to keep that going. We also identified zip codes with higher case rates. And as soon as we were able to get back out in the community, we started retesting in those locations. And then of course our Wear One program continued. That's the condom access. So people could still get condoms by mail, and we still had Wear One packets in public locations for people to pick them up. So that's what I wanted to present to you. Now we have time for questions or more discussion.
Any questions for Debbie?
No, none for me, Al.
Okay, thank you. Debbie, are we still working with Allegan County on this too? Was that a joint venture on this Ware one?
Yes, actually, Rare One is in, I forget how many counties now, like 43 counties in Michigan. There have been a number of counties that have picked it up, but Heather does still have a cross-county operation going on in terms of Allegan County.
Okay, and
Heather, our health educator.
okay. Is there a side effects for STD on any of them? Or could some not even be knowing they got it and go for years without ever being tested?
That's a good question. Some of the STDs are silent, at least for a time. So someone can have one of those infections and not be aware of it yet and be spreading it to others.
Okay, since the,
What zip codes are most prevalent with this disease?
Oh, I was afraid you were going to ask that, and I'm not a Holland girl. I didn't memorize them. Sorry. I could get that information back to you if you like.
Okay, that's not necessary.
Okay.
I can
Don't
just
know
about,
nothing
I
about
think I can
alcohol.
just about pick the zip codes out of that one. So,
Yeah, the last 2 digits is all I really need.
okay, yeah, yeah. As long as it's not in your neighborhood, right,
That's
Jim?
exactly right.
Yeah. Anyway, Debbie, thank you so much. Appreciate
Sure.
the information.
Oh, you're welcome. I just want to remind everyone, we are back in both Grand Haven and Hudsonville. So, you know, and of course, still in Holland. So 3 locations and just one phone number. I had it on the screen a minute ago, but 396-5266. So make sure if you have constituents who are looking for care, send them our way.
Is there any cost if we send someone and said, well, I can't afford to even go? Is there a cost to them? I mean, can they go to the health department and not cost anything?
That's a great question. If anyone has private insurance, we're happy to bill their private insurance. If they have Medicaid, we bill that as well. If they don't have insurance, then we have a sliding fee scale based on their income. So for low income folks, that would slide to 0. Some people, they might pay you know, a 25% or a 50% of the charge. But we always say that people are never turned away for inability to pay. So even if they owe us from a past visit, we'll still see them. So yes, they can be seen here with no charge.
Okay, and now I'm gonna go one step further. How about 16-year-old teenagers? And they think they got it, you know, but they don't want mom and dad to find out, okay? And they're probably embarrassed about it. So is there anything they can do? I mean, through the health department without? You understand?
Absolutely. Yep. So if they're on their parents' insurance and they have an open discussion with their parents, happy for the parents' insurance to be billed, we're happy to bill the insurance. If they do not want their parents' insurance billed, then we treat them based on their own income. And for most young people, they don't have any income, so they slide to 0 on our scale and they get the care free of charge. And we have grants that help us be able to provide that. And also the county is very generous in supporting our service. So yes, we are able to provide care for people with no insurance or low income without charge to them.
Thank you, thank you. Anyway, that's it. So I guess we're gonna go on to the agenda and it's department updates.
Thank you.
So let's start. The first one will be Lynn, since he's sitting here so patiently.
Oh, thank you. So I'll be brief. We continue to be pretty busy at CMH. New requests for services are kind of waxing and waning, but there are definitely weeks where we have a full schedule of appointments, which again, I always say is a good thing that people are reaching out and seeking services. It's definitely keeping us very busy. We continue to have some difficulty attracting staff, especially those positions where we require a master's degree. We've had some positions open for several months. There's lots of competition out there for master's level types of people. So we're having a little bit of success. We've started advertising a little bit more broadly. And I think we've actually got a few more candidates by going a little bit more broad in our advertisement. Most of you, the commissioners, were there yesterday for public comment, and I know there's been a couple emails sent. I just wanted to let you know that we will definitely follow up on those concerns and comments that were voiced either in the email or during public comment. We take that very seriously. We have been meeting with parents and we'll continue to do that if it will help to answer questions and find resolutions to some of their concerns. From the Lakeshore Regional Entity, that is the kind of umbrella organization over us, the PIHP, Prepaid Inpatient Health Plan. It's where the Medicaid goes first from the state. Several years ago, due to some of the financial difficulties we were involved in, the department put us on put the LRE on a month-to-month contract. And I'm happy to report lots of work done at the Lakeshore Regional Entity. They're now off that month-to-month contract and have been awarded an 8-month contract for the remainder of this fiscal year. And anticipating that we'll go back on that month or that yearly schedule. Some of the things that in the agreement in the settlement to get off that month-to-month contract included a little bit more reporting to the department on finances and other QI types of things. And so I don't think that's going to be difficult to achieve. It's stuff that we're doing a lot of anyway. So that's good news. And I guess I'll leave you with, we are busy right now. We have an audit that we have multiple audits through the Lakeshore Regional Entity and other places. And we're preparing right now to go through a pretty large audit. It takes several days of reviewing charts and reviewing billing and data and that type of thing. So that's keeping my staff pretty busy right now. So unless you have questions, that's all I have.
Anybody any questions for Lynn? Thank you, Lynn. Okay, now we're going to go online and we'll start with Dr. Gwen.
Good morning, everybody. Lisa and Marcia are both on well-deserved breaks, so they left me in charge while they're gone. I don't have a very long update for you today. One of our exciting developments over the next couple of weeks here is that the FDA Advisory Committee will be meeting on the 15th to discuss authorization for a COVID vaccine for kids ages 6 months through 4 years. So we're excited about the prospect of that added layer of protection for our littlest ones. There is a CDC call this afternoon that I will hopefully be participating in, that is talking about the planning for what that's going to look like. It will look different than it does for other age groups. People aren't probably going to be bringing their little toddlers into a mass vaccine setting. So we're working with our local healthcare providers to sort of incorporate that into just a normal part of their other routine care like they would with any other vaccine. We know it's going to be a little bit different, but again, we're all working hard on that and very excited about that being available here in the near future. And one other update that I wanted to share is also kind of exciting. Back in November, our community services manager, Sandra Lake, and I applied for a leadership institute that selects healthcare leaders and public health leaders from all over the country to participate in a year-long leadership institute through Human Impact Partners. And Sandra and I were selected among 21 healthcare leaders from around the country, including Chicago, New York, Los Angeles, Detroit. So we're going to be doing some sort of intensive leadership training with this organization over the next year. We'll be doing some virtually and then a couple of meetings in person as the pandemic allows. So we're very excited to learn from our colleagues all over the country and hope to bring back some very useful information to share here. And those are my brief updates for today, unless anybody has any questions.
Anybody got any questions for Gwen? I've been hearing on the news in different states and ours that the COVID is going in a downward motion. Is that true in Ottawa County too?
So we have been seeing some improvements, and Darrell will be providing his data update as he does every week. He's actually meeting with the school leaders now in my place, since I'm here with you folks. And we are cautiously optimistic about what we're seeing. And we're hoping that the improvements that we've seen over the last couple of weeks will continue. And we're just really monitoring the situation closely to see how that affects our recommendations and requirements going forward.
Okay, thank you. Any other questions? Okay, then let's move on. Kendra.
Good morning. All right, so I just have a few updates. First, I'll start with what was out in the public. We had our modified settlement agreement that was originally from 2008 with Children's Rights. So it's a 14-year-old lawsuit that we've modified a few times. And since the last time that we met, they did go back to court, and we are down to 14 areas that we will be focusing on. The original areas were considerable, like I think over 200. So we've come really far, and really looking forward to being out from underneath this lawsuit. Many states have been under a lawsuit with Children's Rights for many, many, many years, even longer than us. And most don't get out from under it. So we're very much looking forward to being able to push through these 14 areas to be able to no longer be under that lawsuit. Since we met, we also received our staffing allocation back, and unfortunately, we did not get approved our prevention positions that we had requested. However, I have made the decision to move one of my CPS and one of my foster care positions to continue our efforts with prevention, as we have seen some great things occurring in our community. And so that is a choice we decided to make. I may not be getting the money for it, but we're definitely seeing some benefits already in the community. So we will be continuing prevention efforts. Some of the reasons for that, we actually did some data polls this last month, and one of them was regarding our removals. And in 2021, we had 42 cases, not children, 42 families in which removal occurred of a child from their biological and or caretaker's home. And of that, 26 of them lived in the zip codes of 49424 and 49423, which is the Holland area, which is 62% of our cases. So really wanting to target some of our efforts related to prevention in those areas. And then lastly, recently I connected with some of our partner agencies, including the health department, related to some concerns of an increase. Even an increase of one is too many in our county related to shaken baby. And we've had a few over a very short period of time, which again is too many. So I really appreciate that when certain areas or concerns rise to a level, that our county is very quick to pull people together and look at how we can address those concerns. So we actually are meeting with a group of individuals next week to look at our efforts, really targeting some prevention related to male caregivers and how to care for infants. Unfortunately, the cases that we have were all male caretakers, and it looks like most of the concerns could have been prevented if education was provided to them. So definitely looking for working together to prevent future concerns and issues. Outside of that, I think that's all I have. Thank you so much.
Thank you, Kendra. Any questions? Okay, next one, Jennifer. Walk for warmth.
Good morning, everyone. Jen from Community Action Agency, and Yeah, that was my, one of my big updates was Walk for Warmth, was just held last, Saturday. It was very cold. Those of you that were there, know that. But it was very successful. We had, outside of volunteers and staff, there were about 90 people there, which was good, I think, considering the pandemic. We weren't really sure what to expect, and we weren't in person last year. So we weren't really sure what that was going to look like. So that was great. So far, we've raised over $22,000. So that is very exciting. Our goal this year is 25. That total does not include any of the online donations. So we haven't seen those come through yet in the system. So we anticipate more. And then we also have some folks that have been reaching out, asking if they can still do a virtual walk because maybe they were ill or it was too cold out. So there's still some money coming in, which is very exciting. I also wanted just to shout out Shannon Feldner, and anybody else that was involved in the Ottawa County newsletter. We got really great response to that. After the newsletter went out, we noticed the checks started coming in. So I think that was really helpful with our efforts to get the word out about the walk. So very excited about that. Being my first walk, I was able to see what we could do bigger and better next time. So very exciting. In addition to that, we're just moving forward with our tax program has been going very smoothly. Again, just 1 day a week on Thursdays. We also, as I mentioned last time, we have our water assistance program. That's been kind of slow going so far. So if you happen to talk to anybody in the municipalities or any other water providers. We're trying to get the word out as best as we can, but just making sure that those that are behind in water bills come our way. We have a lot of money to spend in the next year and a half. We also have another new program. It's through our weatherization grants, and it's a deferral reduction program. So essentially what that means is we have money now to cover some home repairs that are preventing individuals from getting their home weatherized. So we might see individuals that have maybe mold in the home or water leaks or other things that prevent us from doing weatherization. So we have some money until September that we can spend to help those people get those repairs done, and then they can move on through the weatherization process. So that's exciting. And that's all I have.
Okay, any questions for Jennifer? So Jennifer, I did notice that the attendance was down. I talked to the mayor of Zeal and he was there too, but he said, we haven't, is it 2 years now we haven't had it or just 1 year?
Just last year. We didn't.
Just last year. And he thinks that might have a little bit to do with getting people out again. So I guess the biggest thing is not so much the people are there, but the money you got coming in. So I'm glad the newsletter helped you a lot. That's a win-win for all of us then. So anyway, any other questions for Jennifer?
And I think too, and Jen, you may correct me, but we had some big sponsorships or donations. I think Consumers Energy might have been one, and they either no longer do it or significantly reduced their contribution.
Yeah.
That played a role as well, if I'm not
Yeah,
mistaken.
I'm glad you mentioned that, John, because I don't think that I recognized our gold sponsor last time. So Semco Energy, they gave $10,000 this year. So that was huge. I went a little bigger on my ask this year and they came forward, which was incredible. So you're right, John, that Consumers Energy is no longer matching donations. We had that in the past, so that helps boost the numbers up. But I think with Semco's donation, and some other really generous partners, that's helped our number quite a bit.
Good, thank you. No other questions? Is there anybody else on that I don't see? Okay, well, I'll go for another public comment one more time. Is there anybody online for the public? No? Okay. We will adjourn. Thank you, everyone, for participating.
Thanks, Al.
See you guys later.
See you guys.
You bet.